Okay, well, for the interest of time, I think I'm going to go ahead and get going and let people trickle in. But just wanted to say first, hello, everyone. My name is Meryn Robinson. I'm a technical advisor at Palladium, and I manage digital systems and solutions development and implementation. And today, I'm specifically sharing work I've been leading to digitally transform the health policy process as part of the Health Policy Plus project. So the years of working and learning through HP Plus and the growing emphasis on utilizing digital solutions in development work brings us to our central question for this activity specifically that I'm talking about today, which is how can digital solutions be used to strengthen health policy implementation? So I think I'm starting off with a quick poll. So let me just launch that quickly. So you should see it pop up in the meeting. So please feel free to answer the question of, have you used digital solutions in your own work if you work in family planning policy work? And if so, feel free to share which solutions you've used. And that could be anything from dashboards to a monitoring tool to databases that you often use if you're in sort of the development and problem identification space. I'll leave it open for a second. It looks like no responses are coming in, which sort of makes the point of why we did this activity. So maybe I'll, just for the interest of time, move on to the next slide. We can come back to that. So to begin, we first focus on answering the question of why we're focusing on digital solutions and their application to the family planning policy space. So we know there are many ways digital solutions are used to help deliver family planning services. It's evidenced by a lot of research, the frameworks that exist to demonstrate how solutions can be used to strengthen health systems and services, and inventories of digital solutions for different kinds of functions and use cases across service delivery. What's missing is the understanding of how we can do this specifically for policy. So currently there doesn't exist a very thorough and documented understanding of use cases of digital solutions specifically for policy work. So our work for this activity under HP Plus focused on family planning policy work and how we can sort of fill that gap. But I think one takeaway that we gain from doing this activity is also noting that this can serve as a test or a proof of concept for how we can assess and use digital solutions for policy work writ large across sectors, not necessarily just for family planning. And I think a lot of the use cases and functions of the tools that we'll be talking about and solutions that we've identified are absolutely being able to be adapted across contexts. And also, this is all the more pertinent because it's clear that we're in the midst of an age of digital transformation. So connectivity and access to devices like phones and tablets and computers is expanding. And as more and more components of our lives, from things like banking and communication to education, is through digital means, it's becoming more and more necessary to shift our whole thinking of how we can conduct our work in a digital world. And I think COVID put that in even starker contrast as access to digital services and remote capabilities became all the more important. So we know digital solutions can be leveraged and applied to help transform our processes to make them more efficient, inclusive, and effective. But also throughout this whole presentation, I want to note that we also are very aware that it's not that digital solutions can solve every challenge. So what we're trying to do is find the most appropriate and inclusive and responsible application of digital solutions to policy work. But we are also aware of the fact that it's not the answer to every challenge. So to start, we are going to look at the World Health Organization's classification of digital health interventions. So from the increasing use of digital solutions within digital health, in 2018, the World Health Organization put together this classification, and it provides a framework that describes how digital solutions can be used to solve health systems challenges, and also provides a common vocabulary to facilitate alignment and help address gaps across the digital health implementations. So this classification is based on the users, and under each of those intended users, you can see different subcategories and use cases or functions of tools. And the link on the slide there takes you to the site if you want to click around and learn a little bit more about these classifications. But the reason I'm referring to this is because we can see from these classifications that while practitioners have created a common understanding of digital health tools, policy work and policymakers are often left out of these kinds of frameworks or are not included. And so from that and identifying that gap, we then want to move to this activity and sort of what questions we're trying to understand in order to be able to answer the fundamental question of how we can apply digital solutions to policy work. So to get at this gap, we started with just the question that helped to ground the whole activity, which is, what is health policy and why does it matter? So health policy refers to the decisions and the plans and the actions that are undertaken to achieve specific health goals within a society, and it enables health systems and services to be delivered, and also has the power to make enormous impact on health outcomes and equity of healthcare access. So that's definitely a process that we're trying to understand and enable, and also is undergirding why we had this activity in the first place. So understanding how we can use digital solutions to improve the policy process, we wanted to start with a process map, as you do with any good digital transformation process. So we mapped the health policy cycles and the activities that take place across each of the stages. So here you'll see, as I click through, that we use the policy cycle of the 4-step process with sort of the undergirding of stakeholder engagement and advocacy supporting all the steps. So starting with problem identification and then moving on to policy development, policy dissemination and implementation, and policy monitoring and evaluation. So you'll see here that there's a list of activities that correlate with each of the stages here, and it's absolutely not an exhaustive list, but it shows an example of our starting point from then identifying the functions and ways in which digital solutions might enable this kind of work that goes into supporting the policy process. Okay, so I have a second poll I'm going to launch, and maybe we'll get some responses for this one. But the question is around what challenges, if you do work in health policy, have you faced in your own policy work? Feel free to type in responses or submit things through the chat. And if you don't want to share, that's also okay, because we will be discussing that in just a moment. Okay, well, for the sake of time, I might move on to the next slide. But happy to hear if anyone wants to discuss any challenges that they faced. But I'm going to move on. So with our activity, after we mapped the activities that support the policy process, another activity that we did under this work was interviewing policy practitioners across different geographies and from different types of organizations to learn about common challenges across the policy lifecycle. So we see these challenges, as well as understanding what activities go into each of the stages, as well as good starting points from which we can work to identify opportunities where digital solutions can help solve some of these problems. So again, we listed things out across the policy stages. And again, this is not an exhaustive list, but these are some of the discussion points that we talked through with our key informants and policy experts through the interviews that we conducted. So after we conducted our key informant interviews and after we had mapped out the activities across the policy cycle, we also conducted research to identify how digital solutions have been used in health policy so far. So we completed a desk review, and through that, and from speaking with our policy practitioners in our interviews and talking through what tools they use across their work, we identified 122 tools that have a variety of functions across all of the different kinds of activities that go into supporting policy work. And that's a long list. So to help make sense of this inventory of tools and solutions that we've identified, we reviewed each of the tools' functions and created classifications, sort of in the same vein as the World Health Organization's classifications for digital health interventions, but specifically with health policymakers and people that work in policy work as our target audience. So these classifications of the tools after we review the inventory include knowledge management and training, data collection, use and analysis, and citizen and community engagement. And within each of those, there are subcategories because we get a little bit more specific. So now we have these categories to help make sense a little bit of what the use cases and functions of all the digital solutions that we were currently able to identify do. So we also then wanted to see how this maps back to understanding how it impacts the policy cycle so far. So we map the categories based on all these functions back to the policy cycle, and that's what you'll see on your screen here. And I think what is probably true and what many people that work in policy will identify is there's a lot of overlap of functions across different parts of the stages of the policy cycle. So there are things that pop up more than once, and it's definitely not clean cut with all that overlap. But I think this at least helps us provides a sense of how the tools that are currently being used support the life cycles and activities right now, and also helps us again get at where the gaps are and maybe what challenges still exist or what's maybe not being addressed. So through all this work and from our project outputs, we packaged this information into 2 main resources, and there will be a few other briefs to summarize our findings as well. But the main resources that we're working on are the policymaker classifications, which are meant to aid the understanding of the common technology use across the policy cycle, and the inventory of tools which can be adapted and used by policymakers and other family planning partners and practitioners to improve the family planning policy process. And this is all in progress, and we're intending to release these along with briefs that explain how we created the categories and also explain in more detail some of the findings from our key informant interviews, and will be available within the next month. So through all of this work, we tried to summarize some of our main recommendations. So the first is to talk through the fact that a lot of our key informants, in fact, almost all of them, highlighted the persistent challenges of keeping relevant stakeholders and population groups up to date with the latest policy or guidance. So we thought that this presented an opportunity for new innovative ways to use digital solutions to support steps necessary for policy dissemination efforts. And just generally writ large is an example of one of the ways in which we can focus on new and innovative tools that can help address some of the gaps that still exist within the policy cycle. We also see that there are some current digital solutions, including those that enable and support communication and engagement with policy beneficiaries, the general public, and service providers, that can be better utilized to address some of the challenges that were identified through our work under this activity in consultation and soliciting feedback. So the first was around what new tools would be relevant to be focused on, and the second recommendation goes into a little bit more about how the current tools that we have identified might be able to be adapted or used better to enable some of the processes and challenges that still exist. Our third recommendation is around the fact that health policy and public health services are often delivered within government IT environments that have not yet gone through digital transformation. And digitizing pieces of these processes can improve policy development and implementation, but also we identify that these efforts should be aligned with the broader digital government transformation initiatives to coordinate these efforts and resources. Because I think that's going to be a big process that will require a lot of collaboration and again, has probably a lot of overlap and potentially has a large impact on how the policy process could work with some of the stages that fall within the purview of the government systems. And finally, a country's digital ecosystem, including digital literacy, connectivity, infrastructure, and governance, should be considered to ensure that information in both the development and dissemination of health policies is inclusive and accessible. And also, I think it's fair to say, would fundamentally impact how to best digitally transform each of these policy stages, because those factors of the digital ecosystem, as probably those who know, who work in sort of the digital development space, have a large impact on how you can best digitally transform any or implement any digital solution. So I think that brings me to the end of the content I am presenting today. So I just wanted to say, from this work, we're looking forward to making these resources available to help support the documentation and resources that can serve digital transformation of policy work. And also still is a learning process. I think we did our desk review and we did our interviews, but we're also still on the lookout and would welcome any and all updates from anyone who's interested in this work to provide additional inputs on tools they've used or any really any relevant information, because we want these to be useful resources that we can update as necessary. But they're definitely a good place to start as we learn more and sort of help document how digital solutions can support the policy process. So thanks everyone for listening in. I'm going to pause there and allow anyone to bring up any questions or happy to discuss anything. I can go back to the poll questions because I am curious if there's any challenges that people are facing or any thoughts that they had while they were listening as to how digital solutions might be able to enable and facilitate their own work. So maybe first I'll ask if there's any questions or comments or anything that anyone would like to discuss. Okay, no worries. So I think one of the things that came out from our key informant interviews and was mentioned many times was the policy dissemination process and ensuring that the right audience that's impacted by any new or updated policy is aware and understands what the new policy content has an impact on their own. You know, if it might be providers providing services, or it might be beneficiaries or citizens that have access to new or different things, or changing eligibility criteria. It could be a lot of things. But I'm curious if anyone in this chat who works in policy also faces challenges in this dissemination process, or if there are any other, you know, kind of fundamental or large challenges that they face in their own work. just to see if we can validate if that's still a universal challenge or if there are any other pieces of the policy cycle that really stick out for someone that are also challenging.
Thanks a lot, Meryn. This is Frances from Nigeria. So just trying to say that these are actually very universal challenges, especially in regards to policy. So one of the biggest problems that, low and middle income countries face is having very good policies that do not get implemented, right? And most of the times it's discovered that this policy changes are actually not wildly spread. So people don't know that they exist. People don't know. Even some of the people who are responsible for implementing these policies sometimes don't know that they exist. So I think it's actually exciting and intriguing to see how we could use digital solutions to address some of these problems. And I think it spans beyond family planning. So regards to other things like UHC, health insurance implementation and all of that. All these are all the places where, these are the places that could benefit from the use of digital solutions to try to address this policy implementation problem. So I think it's a huge space. It's a wide range of, very interesting topic area that you actually highlighted in your presentation. So I really look forward to, what we could do with all of this in the future. Thanks for the excellent presentation.
Yeah, thank you, Frances. And I think what's interesting, and as you pointed out, it absolutely spans across more than just family planning policy. And our inventory, once we figure out how to format it in a way that's easily accessible, there's actually 2 sections, one of the family planning specific use cases, but that's only about half of it. The other half is digital solutions we found that were applied to more like health policy, just generally. But yeah, I think it's really interesting to look across and see all the use cases and figure out how we can apply those. But yeah, it's also validating to hear that we know we talked to a few people, and I think pretty much everyone we spoke to mentioned how difficult it is, as you said, to once a policy exists and making sure it's implemented, and even that just people know about it. But it's helpful to hear and continue to validate that that's still a challenge that would definitely benefit from having some attention. And yes, I see a hand raised. Please go ahead.
Yeah, thanks a lot. I think I want to agree with you totally on the issue of dissemination. There are quite a number of challenges, and many a times I've, for example, accompanied a team that was going to disseminate, but when we went to do the dissemination, we realized that the engagement was not adequate because the entire team that we went to disseminate to actually mentioned that they had never heard of that type of policy. And so I agree with Francis and yourself that is quite a huge challenge, and I hope digital solutions can be able to assist in dissemination so that it reaches quite a wider audience, because I think with digital solutions you are able to reach many people at the same time, as opposed to having these physical meetings where you are likely to be constrained by the number of people you access. Over.
Yeah, absolutely. Yeah, thanks for your inputs there. And when we were discussing this with the team that worked on this activity, there were even some pie in the sky or some blue sky thinking about what would be most helpful. And people were coming up with things like, can we use machine learning to do natural language processing to look at a policy and pull out the relevant pieces and then summarize it in a way that matches with, the user or the target audience that can summarize what's important in the policy to them. And then is there a way that we can broadcast that or make that accessible? So, we haven't actually done that as a caveat, but there are some ideas people were floating around as to how we could figure out how to address that challenge. So hopefully with this sort of identification as a first step of even just articulating what the challenges are and what gaps still exist is a good first step to identify and help those who are in the innovation space think through how they might be able to apply some of the technology to the gaps that still exist. And I think we're supposed to have people hop over around 50 or 10 before. So I'm just going to go to the next slide with the link back to the plenary session. But just wanted to thank everyone for their time today. And also, I think these will all be posted and available. So if anyone has any follow-up questions or comments or would like to reach out, we're still finalizing everything. And again, we want to learn more in case there's more information that might be relevant. So please feel free to reach out. And again, thank you all for your time today. Okay, great. And Georgie just put the link back to the plenary session. Yeah, I appreciate it. So thanks all. I hope if you have trouble getting back to the plenary session, let me know, and I'll be here to help.